And on a local level, high school basketball state tournaments start next week too. So that's super exciting.
Excellent. Gary?
Well, springtime is sort of my least favorite season here because the winds are so bad. When I moved here, it was a March and well, actually it was a February. And it just was so gray, so windy. And then of course the allergies started. So that's never been fun. It's sort of my least favorite time. But one thing I do think is fun and great is to go to the nurseries and start sort of picking your plants for May timeframe after that last freeze or after Mother's Day. And it's just sort of fun to just see the whole city out there pick everybody's energy. So that's all I have to add. Yeah, everybody froze there for a second, so I wasn't sure if I'd gotten kicked off again.
I thought it was just me. I heard you talking about going to create more beauty right through nature. So thanks. And I hope that you get a reprieve from your allergies for everybody. Eleni.
Hello, everyone. I'm Eleni Bukavalis, she, her pronouns. I don't really think of it as spring yet. Like it's too cold, but I was going to say plant vegetables, which is definitely not something that should happen right now. It's for sure going to snow again.
Hallie?
Yeah, hiking, if you can find a trail that hasn't been too muddied by melting snow. And this season, that shouldn't be too hard to find because we've had so little precipitation.
Yeah, that's a positive frame for the little precipitation. Diego?
Hi, I'm Diego. I'm a health educator here with the Center for Medical Cannabis. Springtime, definitely try to avoid the wind if I can, but I guess my favorite thing would be to travel back down south. And so if that's hiking in Las Cruces or in the Oregons or going to the catwalk in the Gila, maybe even go to like the cherry farms in Alamogordo, or even go to like a spa in TRC. That's kind of my thing. Go travel down south in springtime.
Nice.
Can I ask a quick question? Have they repaired the catwalk down there?
Yeah, I was there last year. It's perfect. Yes.
Oh, wonderful. Okay. Thanks for letting me know.
Yeah.
Great. Selena?
Hi, I'm Selena Montoya I'm the budget analyst for the Center for Medical Cannabis, and I love to find a trail that I have never hiked on. That's my favorite thing to do in the spring.
Nice. Alan?
Good afternoon. I'm Alan Flynmill in Deming, and I enjoy the spring except for the winds, because the evenings are nice and cool and the days are perfect and just can't get any better. And about June, July, we start getting well over 100 degrees here. So I like it now, other than the wind, just perfect.
Thank you. Katie.
Hey everyone, Katie Wickowitz, she, her pronouns, and I love to get in spring skiing when I can. Not going to be doing that at the Sandias, but hope to get up to Colorado soon. But I also hate the wind and love the snow.
Thanks. Dominic.
Hello, everybody. I know it's been a little bit since I've been able to be here, but for those who don't know, I am actually back with medical cannabis, and my temporary position is no longer temporary. It is now no longer mine, which is a good thing. But I'm very glad to be back. And so I'm the director for the Center for Medical Cannabis. And one of the things that I love about spring, and I'm engaging in it right now, is getting all my seedlings started. So I, at this point, have about somewhere around 200 different seedlings of various vegetables and about 50 of flowers that are going, and they're all at about the 2 to 3 inch height now inside. So when we get another month, they'll be able to go outside and hopefully thrive very well. So planting and gardening is one of my main things.
I love the nature enthusiasm, and I feel like next meeting will be outdoors and near your home where we can raid your garden, but we can wait till the weather's better, and I'll mute myself in a moment after we hear from Mateo.
Howdy, I'm Matthew Pearson. I go by Mateo, and I'm a research professor at UNM Center on Alcohol, Substance Use, and Addictions. And listening to your guys' interest, I'm not good at any of the things you're saying. I can't grow anything. I'm new to trail running. I couldn't say it's my favorite thing, but I guess this spring I'm looking forward to traveling. I haven't really traveled in a while. I got a lot of travel in the next couple of months.
Nice. Okay. And Kathy, did we hear from you?
Not yet. I'm Kathy Algeri. I am the IT project manager supporting the Center for Medical Cannabis. Pronouns are she, her. And I think I'm with Gary. I like to go visit all of the nurseries and pick out my plants for the upcoming season. So.
Excellent. Thanks. And then, yeah, thank you. And Carmen, did we hear from you?
Not yet. I'm Carmen Batista. I'm a health educator for the Centers for Medical Cannabis. In the spring, before we would, we're always around our kids doing sports and school events, but this year, since my kids are in the teens, we've given them the option of choosing what they want to do. So it could be fishing, camping, hiking, going to a different state to look, work on cars. So it's just, now it's what our teenagers want to do, so we can see what they want to be when they get older or into adult time. So like that, we can focus on them, and then when they're gone, it's going to be us. So
thank you. And thanks everybody for going with it. I know that it can seem like, oh wow, that was a lot of time on the agenda, and yet also it's important, I think, for us to know a little bit more about each other as people, because it helps the meetings be more enjoyable, but also helps us helps the team have better outcomes. So I know that you have already looked at the agenda, and I know that Gary, thank you for having sent that out and having shared that link, and also cut and paste it into the chat. And I would love to turn it over to you and mute myself.
All right. Well, thank you, Eileen. And again, I think it's been since October since this committee has been able to meet. So it's been quite some time. A lot's been going on. We went through an election and all the what came after. And so it's been a while, and it's great to see all your faces again. And I appreciate y'all being here. It's a great turnout. So for today, since we are in the middle of legislative session, I thought it might be interesting to go ahead and talk about some of the cannabis bills. But before we maybe get into those, and I have a little slide deck to present those one by one. But with regards to the report, a lot of you have asked, what's been the response to the report? And I want to ask, and you can just raise the hand, have you all had the opportunity to go to our webpage and look through it and read through it, browse through it? And again, I ask that because as you go through that process, if there are things things that you want to change, things that you want to adjust, things that you felt might be presented in a better way, let's write those down and keep a tab on those so that we can impart those to the next report. I haven't been over to the Roundhouse this season yet, so I haven't been able to really hobnob to find out, in detailed response, but somebody here has been there quite a bit. Dominic, could I ask, a couple comments with regards to the report that you have?
Yeah. Thank you, Gary. And I will say that I haven't, my visits to the Roundhouse have been specific to the, if you've all heard about it, the medical psilocybin bill, which is Senate Bill 219. So I haven't really been focused with discussing with the legislators about the report, but I have had a few who have said that they've seen it and that they need to read it, which, by the way, is not an uncommon thing during legislative session because they get so many documents and everything else. I can also tell you that our new secretary, for those, I guess we should have mentioned that earlier, is Department of Health, of course, has a new secretary now, Gina de Blasio, who is from the governor's office originally and is now our new secretary starting back in the end of November. She did, because we had that transition right at the time when the report was due. Technically, we were a little late in getting it to the legislature because she wanted to review it. And so she did review it. She thought that it was excellent, had a lot of really great information. And the governor's office also reviewed it and the similar comments back. And basically, then it was forwarded on over to the legislators. The delay, though, in that meant that the legislators got it just as they started getting slammed, quite frankly, with bills and things like that. So hopefully we'll be able to get some more information from some of the legislators at what their thoughts are and what their ideas are. But right now, there hasn't been a whole lot. So, but the governor's office and the secretary were very happy and pleased with it. So great job to everybody. And it just really is a really great synopsis of the data and the information. So thank you all very much for doing that. And we will try to get some more information from legislators. Sometimes it's hard to pin them down. And it's oftentimes the first time they go, oh, I haven't really had a chance to read that yet. And then the next time, because I'm asking them about it, they go, I finally got a chance to look at it. And so I have a feeling we'll have some of that coming up.
Great. And of course, this was just the first report of many. And so, this is the starting point, right? And I thought today it would be fun to go through some of the legislation so that, we might not see a direct link between the report and what's there in legislation, but we can sort of see what's out there in the zeitgeist with regards to themes that our legislators are tackling. And as well, I think that this time of the year, maybe this is one fun thing to do in spring, is to sort of follow the legislative session. Because if you do go to NMLEGIS, you will be brought to a portal and you can actually watch the sessions. You can follow a bill based upon its keywords, and you can follow the legislation as it progresses through. And a lot of times things might stall the first or second year, but sometimes they seem to make their way back. So I'm going to start sharing my screen. And can you all see that? Just a little intro slide. Okay, great. So again, and I thought that, there we go. Here again is the update. This is what I'd like to cover is, again, go through some of these bills in the legislative session, talk a little bit more about our roles with regards to advocacy versus lobbying. I know I sent those emails out with regards to, and again, that was from our comms director, just with regards to the rules that we follow when we go to the roundhouse there, and just sort of, again, maybe flesh that out a little bit more so that everybody's comfortable with that. A dispensary tour, we'll talk about that a little bit later. And then, of course, additional members. So let's start with House Bill 10. And so this one is with RLD and cannabis enforcement. I know that we had some of the members from.
There's a question.
Oh, yeah, Hallie.
I'm sorry, I was just going to write it down and ask later, but I just wondering if at some point, if not today, maybe in our next meeting, we could talk about if there's anything that our committee can be doing to help make sure that the legislators end up reading it in some form. But that's, I know we can't make them do anything. They can't even make themselves do anything sometimes. But that aside, I just thought if we could do some kind of advocacy there, that would be helpful. Just add it to the agenda somehow.
Yeah, thanks. Yeah, I think that definitely if we canvass the group here, we probably each may know someone or somewhere, know our representative. And then, of course, there is always direct contact to them. But I'll make a note of that.
Yeah, and
All right.
Gary, before you jump on, just to kind of answer that really briefly, is really there is no issue at all with reaching out to your own legislators or others that you may know and directing them to the report on the website saying, this was sent to you all in, December, and we just want to make sure that you've had an opportunity to read it and thoughts, those sort of things. There's absolutely nothing wrong with doing that. And
Thank you.
I mean, because as much as we send to them, you should even begin, like if you even saw the number and the volume of reports, analyses, things that get sent from the department, one of my concerns, and I think that you're echoing it here with why you're asking that, is that things often can get buried. And it's part of why I'm asking them while I'm over there. And like I said, the response I get is, oh, yeah, I know about it, which do they really or not? I'm not going to go there. But, and then next time I ask, they sometimes will go, oh, yeah, I remember, I need to read that. And then usually about the third or fourth time, just to get me off their backs, they're saying, oh, yeah, thank you. I did read through and actually do remember something from it. So sometimes it's about persistence. And so that's why I say, don't be discouraged by it. And especially right now during the session, they do get bombarded with so much information. I think just the number of bills that Department of Health has analyzed was something around 400 and something. Was that what they had said, Gary? I'm trying to remember. It's several hundred. And so you can imagine that's just one agency. So they're getting these reports from everywhere. So they kind of get a little overwhelmed. If we haven't heard more from them by, say, about like end of April, so really probably by our next meeting, then I'll start being a little more concerned. But right now it's more about they've gotten overwhelmed and they're human. So we need to give them a little bit of time.
Thank
And I
you.
thought Eileen's comment was great as well with
Oh,
regards to it being a foundation for op-eds and letters to the editor.
yes.
And I know that Eileen, you've done a number of those. And so perhaps you share your secret code when with how you accomplish that next time. All right. So, and again, I'm just going to really sort of go through these pretty quickly. I don't want to dwell on them too much, but I think it is interesting to know what's going on out there conversation wise. And again, you can follow these on the NMLEGIS website, and you can just type in the keyword. This is not all the cannabis bills. There's probably 3 times this many that actually reference cannabis in some way, shape, or form. But I think these are the ones that seem to relate the most to the topics that we discussed last year. So again, House Bill 10. This is an interesting one because this is trying to give RLD the enforcement powers they need to really carry out the goals that they have, or to carry out what their policies are with regards to inspection of grow sites, of producers, also dispensaries, et cetera. And so this bill is actually making it through pretty well. It's passed through all its House committees and it's passed the House floor. And now it's over at Senate Judiciary, where it can be a little bit of a logjam. But I do know that as far as RLD goes, this was a very, very important bill. We didn't really analyze this because it didn't really affect us over here in the Center for Medical Cannabis. But I think when we hear the headlines about, a grow operation that was not licensed, that is from perhaps even foreign owned, this would give RLD those powers to really enforce appropriately what they need to reach with regards to their regulations. So again, that would be a very interesting one. We might see more oversight from RLD and better behavior by some of the producers and growers. So that will be an interesting one to watch. We'll see if it makes it. Now, House Bill 112, it's a little bit of a cleanup bill, it seems. It wants to, with regards to requiring background checks for somebody that's applying for a licensure. It's not really going anywhere. It passed the House Commerce and Economic Development Committee, but it's sort of waiting for House Judiciary, and that's probably where it's going to slow up. Again, it's mostly about the background check portion there and whether they're going to require people to go through that step before they can apply for licensure. This is an interesting one, and I think that it really does share a lot with the report because this is talking about testing of employees. And I know with our, not so much our road safety section, but the protection, when we talked about workplace safety, that this bill, it was introduced both in the House and on the Senate side. And the goal here was to sort of redefine, well, not redefine safety sensitive, but what it was going to do, it was going to deny employers random drug screens. So essentially, there wouldn't be these random drug tests. And what would happen is that there would be some guidelines determined by the Department of Health that would then be enforced by the Workforce Solutions Department. And again, I think that what I sort of analogize this to is we had a lot of firefighters with a lot of interest in utilizing medical cannabis to help with their PTSD, yet because they were in a safety sensitive position, that was not allowed. So again, I think that is sort of an analogy here. And the attempt here was again to create these guidelines, have DOH create these guidelines, and then enable, these workers to partake, these sensitive, safe workers. However, if there was an accident, then they could be tested. So the question is, if they're tested, they'll probably test positive. And I think what this, hones down on is that article, Eileen, that you shared with regards to the need to really come up with a viable solution to really test for impairment that is not based upon opinion. Because a lot of onus is going to be placed on whoever it is that makes the determination to test the worker and then what the resultant could be. Again, this past Health and Human Services Committee probably and the no movement on the Senate side, and it seems to be sort of stuck in House Judiciary as well. We were asked to analyze this bill and didn't have too much to share. We'll see if it makes it into the mix next year. Is anybody in Bernalillo County that heard the firefighters that their union did collaborate with the county? And yeah. So that's sort of a prototype for this in a way. A little bit different because I think that union with the employers with the county will be setting up what the guidelines are with regards to the testing. The state version is that it requires DOH to create these guidelines, which is rather onerous and difficult task given that there is, again, no real testing for impairment other than, based upon personal opinion or evaluation from a medical person. Okay, House Bill 346. This is the one, it sounded really, interesting. This is the one that was supposed to ban Delta 8 and some of the synthetics. At least that's what the emphasis was when you read the news articles a couple months back. There was the one in January where there was a grower in Chimayo and they, RLD had to shut them down. There was this question of cleanliness and plant product, et cetera. But so there was this talk and mention of actually banning Delta 8, these hemp-derived products, and also the synthetics. And when you read through the bill, and I think, Haley, you read through this, I read through this, it really didn't do any of that. It pretty much just redefined what a hemp producer was and just said they couldn't be a producer and a retailer. Well, they can probably find a retailer pretty easy. So it really didn't, I don't think, ban much of anything. Haley, did you have any greater detail to add on that? Or is that sort of what she took from it as well?
It seems like that's what it's trying to do. And so in my analysis that I ended up submitting, I just sort of made the case for why it is important that they ensure that if they're going to do this, it needs to be separate from the regulatory authority of the Cannabis Control Division, but it should be working to limit those products being sold, or age guarding them or limiting where they can be sold and how, those kind of things, and the labeling and all that too. So I tried to make it clear in my analysis that yes, we need this, but they need to do it right. So I don't know what'll end up happening with it.
Yeah, the retail just sort of never was addressed. It just really was talking about the producers or manufacturers. So it was, I don't know, a little bit, a lot of bark and not a lot of bite as far as that one goes. House Bill 527. This was an interesting one. There's a lot. The analysis on this is huge, and again, I do think it's interesting that this is insurance coverage for medical cannabis costs. Now, again, I think this is mostly related to the provider evaluations and so forth, not so much a direct product cost. But there's a lot in this, and I would read the analyses if you want a clearer understanding of it. But it's still stuck over in the House side, and it would be probably unlikely for this to make it to next steps. But again, this was, there's a big lawsuit with regards to compensation of patients that were utilizing cannabis for their mental health, behavioral health issues. And I think this sort of is, the follow-up to that. We'll see what happens. Probably something that would happen a couple years from now, not so much this year, but again, something that we'll keep an eye on. Senate Bill 89. This is, it's removing, when the Cannabis Regulation Act was passed, there was going to be incremental increases in the taxes that could be collected. And again, of course, this was to help the communities, garner more tax revenue. But this is an effort to pretty much cap that, to decrease to stop the incremental increases in the taxation. And one of the reasons for this is, again, the talk of a black market. If you continue to have a product that gets more and more expensive every year, and you're looking at a 12, then a 13, then a 14, and so on percent increase in taxation, then are you creating a product that's so expensive you're just going to engender the dark market? So that's, it hasn't seen any committee yet. So I would assume that we'll probably see tax increases this next year. Yeah, we'll see what happens with that one. And then Senate Bill 152, I thought this was sort of interesting, where counties, I think that if you've driven down some in Albuquerque or other locations, you drive down the street and there's a cannabis dispenser on each side of the road, the whole way you go down until you hit the gas station. Again, this would allow counties to petition a halt or a pause in cannabis licensures for these dispensaries when they feel that there's a plethora or an overabundance of them. Because again, counties weren't really given that ability before, and I think that some of these counties see just a huge number of these dispensaries and want to get a little bit of a control on it. So this is discussing a pause to licensing more individuals. So again, it's waiting over there in Senate Judiciary, maybe not be going anywhere. So again, just sort of a brief dusting of these legislative bills that are trying to make their way through our legislature. And again, if you want to read more in depth about any of them, they are listed on the agenda. So next, I think informed advocacy versus lobbying. I just wanted to sort of, discuss this a little bit more with the group, because I did send that email out, again, not to dissuade anybody from going to the Roundhouse to share and advocate and participate. But again, there's just really a right way to do it. And in a nutshell, pretty much is, if one goes, and this applies to us as well here at the Department of Health, is we go as an individual with our individual experience. Now we participate, we have degrees, we study, you can share those, but we're not the spokesmouth for the Public Health and Safety Committee is all that I was really trying to get across. Dominic, you are much more eloquent at sharing this than I am. I think we were in a session last night where it was textbook, the way the individual introduced themselves. You just want to elaborate, Dominic, perhaps?
Yeah, so we had last night I was attending one of the hearings in the Senate Judiciary Committee on the psilocybin bill for which is Senate Bill 219. And essentially there was a doctor who was coming in to advocate for the bill, and when he started his talk, he spoke very clearly about stating that he was there as a private citizen and that he needed to make sure that everyone understood that he was not there to speak on behalf of his employer, the VA, or the DoD. And so by kind of doing that, he was able to establish some of his credentials, but also be very clear in saying, I am not here speaking on behalf of the VA, but in a way, when doing that, that also makes it clear that, look, here's the experience, here's the knowledge, but you're not speaking on behalf of that particular group or organization. And he did it very well. If anyone's interested in seeing it, I'm trying to find the timestamp, and so when I will, because they do record all the committee hearings, then you could go and look at it, and I'll make sure to put in the timestamp so you can sort of see exactly what we're talking about as far as how to sort of give that disclaimer and still be able to present and advocate when you're interested in doing so.
Again, that's a little bit different than if you've been asked by the legislator to be their expert witness. Okay, that would be you're sitting next to them at the table. And of course, in that instance, you're going to introduce, in my instance, I would introduce that I'm with DOH. But again, that's functioning sort of more as that expert testimonial witness, and you're there sponsored by the legislator, as opposed to going there and adding comment at the end or adding personal advocacy. Eileen.
This is such a wonderful and important conversation to have. And I wonder if I may add a couple other different observations. And one of them, for my colleagues who are also not employed by the DOH, which is that the Hatch Act is, it's very complicated it is very complicated and potentially risky if there could be if any of us were to mistakenly imply that that there was a particular specific engagement or involvement of people who work for the state and people who are on this call right now who are employees are being involved in trying to influence the outcome of legislation without when they weren't asked to be experts. So I'll be as explicit as that there are real issues with people who are public employees expressing their opinion on their work hours that have come up before in other settings. So having said that, I hope that in our citizen legislature that people here choose to draw upon our report to represent their own views, and that they represent their own, and they draw upon our report as something that is available to any member of the public as well as any member of the legislature, to know what this expert group of people, what were the findings and the recommendations. I also hope that one of the things that we can all try to keep in mind when it feels as though, my God, we did this incredible work and yet it isn't being drawn upon. I hope that we can all know that much of the work of the legislature is done between the sessions, and so that it would be the work that is done after the legislature has completed the session, and that when there are the committees that are happening, that this information is likely to be even more impactful. So I think it's okay for us, and I'll encourage us to adjust our timeline of when we're expecting to see any outcome. My own experience with getting, in this case, a regulation that was about a statute changed. One of them was 5 years. One of them was 5 months, which pretty much never happens. It's okay to be patient, and I'll stop there because I think I'm risking really being circumlocucious here.
Ellie.
Yeah, well, thank you, and thanks for adding this to the agenda, Gary. Just a side note, does New Mexico have something similar to the Hatch Act? Because my understanding is, and I used to teach these in policy advocacy workshops that I'd run, that the Hatch Act was only federal, and the state legislative activities is governed by state legislation. So I'm not familiar with the New Mexico one. Do you
Thank you,
know
Howard.
that, Eileen?
You're right. Hatch is absolutely federal, and what's coming out here is that I worked for the federal government for 12 years, and also I think I thought of it upon hearing Dominic describe this person presenting themselves, and I think that they may have said that they were not representing the VA is possibly what I heard. I'm not sure. I think that generally for government employees, it can be very, very touchy, even if it isn't explicitly prohibited, that it can
Sure.
be, there can be real implications for people's jobs.
Understood.
But you asked a very tactical
Gary
question.
or
Yeah.
Dominic or the others who are part of DOH, is this something that's an issue for you all?
So yeah, it is actually very much an issue. I'm not sure if there's a specific set of legislation that's been passed in New Mexico that actually sort of mimics the Hatch Act, but the Hatch Act does actually also cover state employees as well to a certain extent, especially when there's any kind of federal funding that is potentially involved. But my understanding is there is something here in New Mexico. I just am not sure specifically what it is. I know we are covered on it, for example, under the Governmental Conduct Act, that has many of those elements of the Hatch Act essentially in it,
Okay.
and that fits under the improper influence portions of it. But I'd have to go and find that specifically. That's actually, I do know it's from the Attorney General. I'm actually trying to do a search on that to try to see if I can find it, so that you all have that as well. But that does cover, as a member of this committee, that would cover as speaking on behalf of this committee. And so that's part of why all of that sort of comes into play under that governmental conduct portion. But it's a good question.
So now I'll go back to the mainstream of the question as opposed to that particular question. But the reason why I found I fully understand the request that you sent out, Gary, and I've certainly been in situations where, for example, when I was president of the American College of Preventive Medicine, I would speak on my own behalf and not the colleges. And at other times, we'd have clear policy statements, and I'd speak on behalf of the college. And one needs to know what one is doing at any one time and be clear about that. What I was curious about, and not for this session, because the session's over in 17 days, I think, or maybe 16. The fewer the better days, I would say. But that aside, thinking about this for future sessions, if we have recommendations that may be relevant to a particular bill that arises, for someone on the committee to also state they're part of the committee, even if clarifying that they're not speaking for the committee, that's what I wasn't really sure about. Because adding the fact that you are on a committee like this can also, besides whatever your other credentials are, can also add to your credentials in some way. And again, I'm not saying this because I intend to do any testifying right now, but I was just curious, in a sense, philosophically about the question in that respect.
Yeah, and it's actually a really good thing on that. And you can say, like I said, the example that, and again, I did put the video from last night's hearing into the chat along with the timestamp. So I think that will help satisfy the question you're asking, because it really is something you can still say. I am a member of this committee. I am not, however, here speaking on behalf of that committee. But it is actually then giving, here are some of my credentials, and this is why I'm knowledgeable about this topic. And that's perfectly fine. Also, and I should have mentioned this earlier, just as a side note, we used information and material from the report in some of our analyses. So it also was very helpful in that way too.
Yeah, that was for sure. And yeah, I think if you watch the example, the clip there, the gentleman did introduce all his credentials. For example, he probably would have listed that he was on the Public Health and Safety Advisory Committee, but then when he got into what he was talking about, he did personalize it and state that he was again there for himself, and then shared some really personal stories that were very powerful. So, did we want to talk any more about that? Is it there's still any lack of clarity? Again, if there is ever an opportunity that the committee gets requested to present some of their findings and recommendations, of course, I think in that instance, it's going to be obvious that you're speaking for the committee in that instance, but we haven't been offered that opportunity yet. So, all right, let's move on to the dispensary tour. We were fortunate enough, the health educators and some of the other staff members, we did go on a dispensary tour. We did find it really, really informative and helpful as well. And they were very gracious. And again, this is one of I necessarily can't advocate for them, but one of the more premier dispensaries that does actually have an eye on instruction and education. And so they were more than happy to have us come back. We thought that this might be something that we could include some of the committee members on, if that was something you were intrigued about. And they do have Albuquerque locations as well. And I'm sure that they would, allow us either. We went to a Santa Fe location, and so those in Santa Fe, we can, we plan to take some of our staff out there again, and we could include some of the committee members that are here locally, and we could tap into perhaps a visit at the Albuquerque site if we do have some individuals that would like to have this experience. The dispensary is called Verdes, so there are some Albuquerque locations down there, and I've actually been to both places. So if that is something that you would like to attend, just let me know, and then we can start trying to create a date or find a date that works, and then we could go and meet with some of the members there. If somebody wants, maybe even perhaps in the future, a grow facility, those are also very interesting as well, but this was just the dispensary tour at this point. And then again, recruitment of additional committee members. We do have 8 currently, and I think that Katie, I saw you raise your head. If you are familiar with anybody that has an advocacy for this type of a committee and would like to join it, Katie, I'll yield to you. Yeah.
Yeah, so I'll be stepping down. I told Gary I'm going to be stepping down from the committee. I'm just a little bit too overwhelmed with my job responsibilities as of late. And with the federal funding pressures, it's a new fire to put out every single day at my job. So I'm going to be stepping down, but I have a couple people at my center that I could nominate if and could send along CVs or information if that would be helpful.
Go ahead and send those to me when you have those, just the
Okay.
names for now, and then we'll pursue it from that. I'll probably reach out to them after we get those names. But again, if anybody else has a connection that would like to serve on this committee, please offer them the opportunity. We can have up to 15, and anybody would be welcome, of course. Well, not anybody. We want to, of course, vet our committee members and make sure that they're able to add useful information. But keep in the back of your mind there. So that being said, I did include some articles there. Some of these articles, I think Eileen, you had sent one. Hallie, I think there was one from the New York Times there. I don't know if that token worked for anybody to be able to read that one article. It was sort of difficult if you didn't have a Times subscription to access it. But I did find the article that Eileen had shared really informative because it sort of dealt with, again, that workplace safety aspect and the whole idea of testing. Did anybody have a chance to review any of these? I know it was sort of short time frame, but I thought we could just sort of, these are all from January and December and very, very recent. And so I think what I'm seeing is that there is a flow of articles coming out now. It does seem like more studies are being done. And I don't think that you can't look at the paper and there's cannabis is in your news feed at least somewhere every day, it seems. And part of that's probably the AI following what we're looking at. But again, it does seem to be that there's more and more information out there. But again, I thought that we could just sort of touch these really briefly and then decide how, in these meetings going forward, do we want to have a journal article each time, or do we want to focus on the themes of the presentation each time? And again, just to sort of get the ball rolling there. But again, this article, and again, the link is in the agenda if you do want to get the full scope. But again, pseudoscience and the detection of marijuana-based impairment, we can and we must do better. And, I thought that this was so apropos because this, again, it was literally that one bill, and it's been very difficult to explain that we just can't test for impairment. And it's even though we've been sharing this information for a while, there's still these bills coming up where they want to be able to test for impairment and make a determination on the job site whether somebody was impaired or not. And there just doesn't seem to be an understanding that that is not where the science is yet. We just don't have that ability. And I did think that these are just 3 quotes from the article that I thought really exemplified, what they were getting at, that we must develop and adapt a scientifically valid, objective, and reliable method for detection of marijuana-based impairment that can be practically implemented in the field. And that the need for this research and leadership is now acute because legalization makes the identification of marijuana-based impairment as opposed to possession, which was the old legal threshold. It's urgent. And again, we see this with our firefighters that want to utilize cannabis off the job, but we know that if they use it regularly, they're going to test positive. And I just, it sort of boggles that if they have any accident, they will likely pop positive for cannabis. And then I guess that means they're going to be fired. I don't know. Those are questions. Again, when people's employments or livelihoods are at risk, we have to get this right. And I think that that's what this article really, really shared. And it really called for the medical community to step up to the plate with regards to toxicologists and providers and lab, that we are stepping up to the plate and really creating something that's science-based and impartial, but also effective. And again, I thought this was interesting. There's more than enough tax revenue collected from the sale of marijuana to fund research into managing the social cost of cannabis use, specifically very robust, scientifically rigorous research into finding an objective, valid, and practical indicator of impairment on the highway and in the workplace. I think that's the billion-dollar question. If somebody can come up with the answer, that would be great. There was talk about these, saliva tests and so forth, but nothing really, I think, has come out yet to provide that objective test. And I just thought it was, going back to that one bill where they wanted our department, DOH, to create guidelines that were going to somehow be impartial and that could be utilized to measure impairment, which we know is just a very, very, very difficult thing to do. So thank you, Eileen. I thought that was a great article. You read it as well. Did you have any comments that you drew from it? Why did you share?
So I thought your summary was spectacular, and I thought that you and also the team would be interested in this for a few reasons, and one of them because it validated, I think, I mean, it's always nice to have the validation that I think that the output of this project was one that was very measured and that looked at where the data is and where the data isn't. And I thought that I was really happy to see that. I also thought that I had not put together the idea of like, oh my God, there is money that is available to help us answer this question. We just have to have the will. And that making the connection there, I thought was really important because for so long, if one, like in medical practice, one has known that the presence of a substance doesn't equate to being impaired. And to find out that not everybody knows that was very interesting for me. and very humbling, right? Because we all think that everybody knows what we know, or at least I do. So I thought that maybe that was all my points, is one of them, that I thought that the call to, like, yeah, we got to fix this. Second, oh yeah, we have the ability. We just really have to have the will, because we really do have the money. I think was I thought was really, really well stated. So I think that was why I shared it. I don't know if you were looking for something that was more a deeper reflection than that.
Well, no, I just think I thought it was really interesting. There was another point too where they we talked about the DRE and how that sort of is what, the option is now, is to have somebody that's out in the field at least be trained to identify more appropriately what is impairment and then what could be the source of it. This article sort of took a little steam out of that. And it just said, we just can't leave it to that. We can't leave it to an officer out in the field to be trained to do a neurological exam and have that be impartial and have that really actually be, just in a way. It said, we can't just put all the eggs in that basket. We need to take this to the next level and really find that laboratory or that really empiric way to measure that can actually satisfy these work requirements that people face. So yeah, I thought it was really interesting. Interesting piece, and I think that that might be something that this committee can draw back upon as we approach that workplace safety section in the coming year. So let's move on. So again, this was another article, and I think this was just from January. And again, the objective here was it was a cross-sectional study to examine the differences between cannabis use and CUD prevalence in medical patients that identified as medical users, or they were medical and non-medical users, versus strictly non-medical cannabis only use. And the age group was 18 to 49. And it was interesting. I would have thought that maybe the medical patients that were using, the individuals that were using it medically, might have had a little bit more oversight, that there might have been less likelihood that CUD would develop. But actually what they found is that those that were medical only or medical non-medical actually had a higher prevalence of cannabis use disorder at all levels, and reported more frequent cannabis use. So I thought the conclusion was interesting. It's just that really clinicians need to consider addiction and really consider that each time they're recommending cannabis to somebody, really make it part of their evaluation, and that they should monitor for cannabis use disorder emergence in our patients. That medicinal cannabis, as with any substance, there's always a risk involved, and that we need to not just accept, or, this is a message I try to get through to providers, you can't just accept that it's safe in every instance all the time. We do need to have a bit of vigilance. And so I was a little, wow, okay, this was an interesting little sidebar here. But again, a lot of these little stages are finding their way through. And oftentimes the pendulum swings the other way, and you find a study that's a little bit, maybe not as maybe softer on cannabis than this one was, but it was interesting nonetheless. And there's the link if you want to read more of it. This was interesting as well. Brain function outcomes of recent and lifetime cannabis use, and what they were looking at here was lifetime history of heavy use, and then recent use, and then brain activity. And what they found is that both recent and heavy lifetime cannabis use were associated with diminished brain activation and cognitive performance during working memory. And that was a small to medium effect size. And again, the conclusion was that, of course, we need more studies. I think that's always what every one of these articles about cannabis seems to end with, is that we need more studies. And I do think that we're making headway there, and we're going to learn a lot as more of these studies do become available. And then I think last but not least, this one was a little difficult to grasp, but what it was trying to do was it was looking at dispensing dispensing habits of what changes with regards to benzos and antidepressants? What are the providers? How do they adjust when a patient is utilizing cannabis? And then, so what they found is the cannabis access was associated with reduction in the dispensation of benzos. So the providers, if the patient was utilizing cannabis, were less likely to recommend benzos. However, there was an uptick, though, in antidepressants and antipsychotics. And of course, again, the conclusion was more research is needed. They assumed that, you know, the reduction in the benzodiazepines was because there may be a downstream aggregate of decreases in the prevalence of adverse effects associated with the benzo use. And then with the increase in the antipsychotics and antidepressants, that might indicate a decrease in aggregate mental health outcomes. So, you know, again, interesting, you know, I'm intrigued sort of how providers prescriptions might change if they have a patient on that is utilizing medical cannabis. And I'm not sure if anybody has had a patient that they've adjusted. I don't see a regular clinic anymore, so I haven't really had the chance to adjust somebody's medications based upon whether they were using cannabis or not. Definitely with the opioids, we would hope that there's some attempt to at least maintain or reduce opioid use if somebody's adding cannabis in. But has anybody else had a patient or has come across an instance where you've wanted to reduce somebody's access to benzos because they were using cannabis or adjust other medications? Again, Eileen?
I've seen more often that the idea of trying cannabis is to try to reduce opioids or to try to reduce benzodiazepines. And what is complicated is and challenging is to have the informed discussion about how one doesn't really know how the dose isn't really known, and that even the most conscientious growers and dispensaries, it's really difficult for them to know for any of us to know what is going to be the impact of a given dose. So, and also that it's hard, particularly in the case of benzodiazepines and the diagnosis that we're trying to treat, is what will be the impact on that person's mood disorder of using cannabis, because it's known that, say, for example, PTSD can get worse with cannabis. So I think I halfway answered your question, which is, have I seen it? Yes. Has it been complicated? Is, I guess, what I wanted to introduce.
It is complicated. And one thing I thought was interesting, that if you're increasing somebody's antipsychotic medications, they really shouldn't be on cannabis anyway. If you're worried about psychosis, it's almost a contraindication to it. So again, there's that instance too, where, you know, are we getting the message out there, or are providers getting the message? I thought that was, you know, interesting that they wanted to perhaps increase some of these other medications when actually there might be just contraindication if cannabis is involved.
I was going to say that I found that it's nearly impossible to stop the cannabis. And that's another, I think I've had a number of patients who have had, say, the hyperemesis, and have had some pretty catastrophic consequences. I mean, one of them had Aaron's mediastinum as a result of it. And so people they can decrease. Many people can, but not everybody can. And that we don't have great treatments that are widely available for cannabis use disorder. So that's one of the things that's kind of tough. Not unlike how it's difficult for people to not have alcohol, right? There's so many nuances. So
I think that the tolerance break and really introducing that early for patients so that they don't crescendo or, you know, continue to increase their consumption of cannabis to get the same effect, to just either, you know, insomnia is a big one. And a lot of patients seem to really benefit from that. It's probably the sleep that's helping them a bit as much as the cannabis. But, you know, if they have heavy exercise on a day, maybe don't take the cannabis for sleep that night. If they take a melatonin instead, so break it up during the week, or I think typically what's been recommended, I think Vermont had a pretty good article, is taking couple weeks or a month off, you know, every 3 or 4 months so that they're resetting and becoming sensitive again to the THC, so they're not constantly escalating and escalating and escalating. And I think that we need to introduce that concept earlier on, because people sometimes, medications you take twice a day, 3 times a day, what have you, cannabis does not shouldn't be a daily, every certain time of each day type of a tool in the toolbox. Hallie.
Because I haven't seen patients in years, but I have most of my friends are over 60, probably over 65 or 70, and nearly all of them talk about using cannabis for sleep. And I've had more than one friend who then in the middle of the night gets up to go to the bathroom and falls and has a major incident, one of whom was really out of it for 6 months or longer because of brain trauma associated with hitting his head on a concrete floor. So yeah, it's a tough issue, and I don't know how, when you talk to, even when I talk to friends and say, well, you have to look at these questions in relationship to the other medications you're on and how they might impact, how they might change the metabolism of those medications, and they don't want to hear it because the assumption is it's been approved by the state, therefore it's safe, broadly. And these are, mostly educated people who should understand the differences here, but don't.
Thank you. Yeah, no, it is this tacit approval that people assume is there, and it's hard to get around. And again, youngsters especially are a group that are really affected by that.
And I wonder partially too, you mentioned this proposal, one of the legislative proposals on requiring insurance to cover medical cannabis. And I wonder what that will do in the long run in relationship to this, but by putting another imprimatur on the question. When I was at Aetna as their medical director, we used to be told all the time, well, my doctor says it's okay, therefore it's okay. And, if it wasn't FDA approved, if it's in clinical trials, they wouldn't make the differentiation between the two. And here we have very few, good clinical trials and, even fewer safety trials, I think, overall. So it's if insurers therefore have to cover it, again, it will be that imprimatur that says this is just fine, you go ahead and use it.
I think that bill might just be sort of jumping the gun here a little bit, because I think that it's probably a better setting after rescheduling were to occur. I think that's maybe when that bill would have more impact, because I'm sure any insurer with a federal affiliation will find a way to back out, right? But not only that, depending on how the FDA wants to respond, do they say, well, we're rescheduling it, and so these are the 3 substances that are the 3 formulations that an insurer will then cover. And we might find that severely limiting for patients, and patients might lose a lot of options. Or I'm just not so sure any insurer is going to cover dabs and the high concentrates, which have not really been shown to be helpful or effective. More problematic, definitely in the age group that seems to consume them. So, yeah, I think that it's an interesting bill. I think it's a little ahead of its time, and unless rescheduling happens, I don't think anything like that necessarily will make its way through. But again, I'm just speaking here what I see. I'm not speaking on behalf of DOH or anything like that in this session, but that's just sort of what I see through my lens. Any other comments? All right, well, we'll move on to just our remaining agenda items. I hear the wind is picking up. We might lose our electricity or internet connection here, so we'll, keep the meeting going. But Eileen, I'll just send this back to you. These are the remaining items from the agenda we haven't yet discussed yet.
Yeah, thank you. So one of them that is very tactical that you alluded to is about if we wish to continue to have journal club. And I say that because I thought that was a really meaningful part of the work. And I think that was part of what helped us get to where we got to with such a successful report. So what I'd like to do is I'm going to go to see if I can, oh my gosh, my internet is so slow right now. I was going to ask if in general that if we have support for continuing that approach, that by Journal Club, of course, I mean that every month that we ask for a volunteer, and then at the next meeting that we have 1 or 2 articles that we just discussed that have emerged in the literature. And my internet is so slow that I actually cannot see if people are broadly. I will ask you to unmute yourself if you disagree with that approach. Since I can't see people raise their hands because I can't scroll. Okay, no unmuting. Great, so we're going to continue. Okay, so so I love that. Of course, that does introduce a very technical thing, which is having people who are willing to present articles for next time. And I will ask if you would consider adding your name to the chat if that's something you're willing to do. And if we have to circle back to that after we schedule the next meeting, then that is okay. So maybe we'll do that instead. I did hear a couple other different things that are other items. So one of them is just to circle back to please ask people if you wish to participate in the tour of the dispensary to reach out to Gary. I also heard that we are all hoping that people draw upon the report that we put so much work into, and that is really remarkable, to speak as a citizen on your own time at the legislature, to contact your own elected representatives and to consider other forms of advocacy that could be such as op-eds. That is obviously one that occurs to me a lot because I write letters and op-eds, but I welcome others as long as we're always really clear that we are speaking on behalf of ourselves. So that is one of our asks. I'll ask that we continue to recruit prospective new committee members and that to be in contact with Gary for who those people are. The biggest thing that I'll ask for is that those would be prospective members who really respect the science and that are in the spirit of the work that we had done before and just understand the limits of the science too, right? Because we want to comment on the public health, and that is a scientific field. I heard that there was I saw in the chat the possibility of collaborating with the regulatory committee. And I'm going to ask, I love the idea of that, to see what could be some options there. And so colleagues, I'm going to ask if that is something that broadly we would have some support for from you, is to ask them to come to an upcoming committee to see how we might have ways to collaborate. And I'll ask if you can maybe raise your hand if you think that that is a good idea. Thank you.
And I put the link here. This is the example of the sign, and Haley, thank you for sharing this. So this is what Washington Health Department is putting in dispensaries. And I don't know which pathway to take with regards to reaching this. We've been reaching out to the dispensaries, Diego and Carmen, and we've been doing some educations with them. Again, trying to help the quote unquote bud tenders. We want to think of a different name for bud tenders. So if anybody's onto something, let us know. But helping them, the interaction with patients when they come in, to make that more fulfilling for the patient, that again, to recognize what the patient's coming there for, not necessarily knowing what their health condition is. But for example, if you see a patient in a walker and oxygen, you're not going to recommend to them high doses of concentrate or necessarily inhaled versions, or the pregnant patient. And so we're trying to have an impact there, but we are making inroads for the dispensaries, and we've been able to put up some QR codes that link to our Cannabis Learning Lounge on our webpage, which is full of all our handouts. This is, again, more direct, and I'm not sure if we would need approval from RLD to become this direct, or if just the dispensaries could put this up on their own. Dominic, what's your thought on that? How do we achieve that without stepping on toes, I guess?
Yeah, so the dispensaries are able to put up information as they wish, because they are their own independent organizations, or businesses in this case. And we have actually requested of the regulatory committee in the past, especially when they were first starting, to ensure that there was information and warnings with regard to certain, with, for example, overusing and things like that. And they really, for the last 2 years, have been dealing with trying to get things up and running, quite frankly. But some of their membership has changed over the last 6 months or so. And so we may have better luck in trying to get in front of them to be able to provide some of this kind of information and collaborative work. So I think it's worthwhile to attempt and try again. So Haley, the meetings are all public meetings, so you can always go and sit in. We've actually presented to them previously, actually multiple times, and we've invited them. We had invited them multiple times, actually, to this meeting, and I think only one time their previous chair had attended one meeting here with
I'm
us,
wondering if
but
can we formalize that somehow? Could Eileen meet with their committee chair or talk to them and say, hey, how about if we just assign somebody so that we have this ongoing communication?
yeah, and we can actually forward that request as well.
I would appreciate that because I think it would be really wonderful if there was more understanding. It can feel natural that anybody on their side might feel like that we are muscling in on their area or somehow undervaluing their work, when instead I think this is just about conversations and collaboration and how we can do the best thing, right?
Yeah, and I think sort of a soft approach, we will continue to ask dispensaries one by one, can we post this here, and maybe come up with even, more materials like this. And we are doing that. The requiring portion of it, that would of course require the collaboration with RLD because they're the ones that have that oversight. So that's where we could then make it a requirement that, I think getting it out there, starting with some of the information that we have, and then maybe working up towards some more dramatic counseling like that last handout. Something we could definitely try to achieve.
And just as a note, when all of the licensing and compliance was still under DOH, there were some of those requirements to have warnings and other items posted. So.
Yeah, thank you. So it sounds like we have one action item from there, which was the outreach that we'll be conducting, and invite them very explicitly and look to see if there can be an offline conversation perhaps. And I would love to participate in that as well. And thank you, and love to report back. The other thing that I felt like we were getting around, but possibly weren't, but I didn't hear like a rallying around, could be what are the opportunities to have a closer collaboration with the Medical Cannabis Advisory Board? Knowing that is an independent entity, and I know that some people here are also on that committee, and I am too, but that there's an opportunity possibly there for cross collaboration too. And I wonder if I did see Dominic and Gary nod, and I'm not sure if that was a nod in agreement or a nod of I heard you. And I'm just a nice validating person who lets you know that I heard you. Okay, so I think that might be an opportunity as well too. And
I was acknowledging that you and Alan both are on the Medical Cannabis Advisory Board and have a unique insight into how that board seems to work a little bit different, and it does function differently, and they have a different end goal, and so now the wheels are just turning of how to how do you see that collaboration, I guess, or what's
yeah, that's a great question. I have some thoughts, and maybe I'll just be really brief, and then would love to hear from Hallie. I would think that there could be a conversation that is friendly, that is about what is the work that we do and what are the findings that we had, and and the question and the curiosity, which is, are there ways for us to work together for the betterment of the health of New Mexicans? And one could start from there. Hallie, I see your hand is raised.
Yeah, thanks. So I want to hear from Gary what the different end goals are in a minute, but let me just ask a different question first, because these are other items from committee members. I think we're still on that agenda item. I guess my question would be, maybe for next time we talk about what our short-term and long-term goals are in terms of what this committee needs to do before the end of the year. I presume we have to have another report December 1st. Is that correct? So, we may have a 3-year plan for certain areas, and we may have now a 9-month plan for others. And it would be good to start talking about after, maybe we should all reread the report before the next committee meeting. And then that might stimulate some additional thoughts also for what we want to do this year, other than sort of updating data. I think we need to do more than just update data.
So yeah, I would encourage anybody, if you read, as you read through, think about how or what direction some of these sections could go in, or what section could be elevated maybe more than it was last time. And so just keep a mental note of that. And yeah, I agree that keeping those goals in mind would be great. With regards to the Medical Cannabis Advisory Board and Public Health and Safety Advisory Committee, yeah, the Medical Cannabis Advisory Board's been around for quite a bit longer. And again, it was created more to determine what qualifying conditions should be added to the list of qualifying conditions, as well as determine what adequate supply or how much cannabis a patient really should have access to in order to maintain or to help with their symptoms. And so their function is not so much in education or generating a report, as much as the only thing that they really generate is they'll vote on whether to move a recommendation forward to accept a new condition to the list of qualifying conditions, and then that recommendation goes to the Secretary of Health, who makes the final determination. So again, I think early on, a lot of the participants on the advisory board were very much advocates for utilizing cannabis to address some of these qualifying conditions. Again, they sort of have to wait for a petition to come before them to really discuss it and then determine whether to move that recommendation on or not. I think the Public Health and Safety Advisory Committee is much more new. It's sort of what we need now, maybe more, because I think that we've fleshed out pretty much all the qualifying conditions that there really are. Not all. I'm sure there'll be others, but the advisory committee, it's more educational. This is now, we're migrating over to informing our legislators and hopefully the public as well through the report about how it's impacting our society more so. I think the advisory board was sort of more that initial nexus to get things lifted off the ground, and it's the committee now that has this the goal of really showcasing how cannabis is impacting us, and then maybe how to make it impact us better, or how to improve the way it interacts with our society. So yeah, that's just sort of in a nutshell how I see the two. I've not been with the program as long as some others on this call, but I'm not sure if they'd like to add any commentary or not. But I think that pretty much is a synopsis. I'm not sure, Eileen, if that's what you've seen, or Alan. Hi, Holly. Or Haley, sorry. But yeah, that's in a nutshell. And again, if you want the dogmatic version, you can always read that in the regulations. But again, yeah, it's pretty dogmatic when you read it there.
Well, one of the things we've discussed in prior years on this committee was the question of safety associated with efficacy, and is the medical committee taking all of that into account? It sounds like from what you just said, because you didn't use the word safety in terms of the medical committee, am I missing something, or were they not as concerned about safety in terms of determining indications?
Yeah, Hallie, thank you. Forgive me. Because we're seeing that some people are going to have to drop off, and I think that's the reason to have the conversation.
Sure, yeah, we can do it another time. I'm just curious.
Yeah, and because also with the literature about state decisions about medical and the effects on public health. So I think that's it, that we can just have a conversation with the Medical Cannabis Advisory Board and maybe come to better understand each other's work.
Sure.
Yeah, I wonder if so first, thank you, and thank you for allowing me the chair's privilege to do that. I want to be sensitive that people might have to go. I had a couple other things on my notes that were of some additional items, but I wonder if what we should do first is settle on a date to be respectful of people might have a hard stop. So colleagues, we've had our 2-month meeting cadence, and then we accelerated that as we got closer to having to submit our report. if we decided for going to 2 months, which I think is okay for May, but soon thereafter, we might want to meet more closely or have more asynchronous meetings. That would put us at Thursday, May 8th. Broadly speaking, what I'll say is I'm glad that it worked out for so many people to meet later in the week. My personal preference would be later in the day, so to start at 3 instead of starting at 1:30. But this is not a committee of one, this is a committee of many. So first, maybe I'll ask people of, broadly speaking, how does it seem for you? I'll ask you to raise your hand if it sounds like making it on the 8th would work out. And if you can raise your hand so we can take a look.
Do you think we should go to every other month instead of every month? I mean, that's the first question.
Well, I think that, my suggestion would be that we initially go to every other, so that would be May, and then we probably will compress that when we see what is the work that we need to do. Because I think we can always have more meetings that have more updates, but I think that the time spent that is generative is the best use of our in-person synchronous time in the middle of people's days. So I think that for the next one would be 2 months, and then after that would be that we could decide and probably would start to go to a more frequent.
Okay, so you're just saying this is a 2-month interim rather than we're going to 2 months, sure. Okay.
Yeah. To revert back to what we had done before we were sort of in the sprint for our first report. So I saw mostly hands that were raised that would work out. I'll ask people to unmute yourself and specifically say if meeting on May 8th will not work for you, in case I missed you.
I like your idea of starting a little bit later at 3, because every Thursday is one of my clinic days, and it's a little harder at 1:30 for me.
Thank you, Alan. Okay. So I didn't hear anyone say that they couldn't make it at all that day, so we'll move forward with the 8th, and I will ask about if you would indicate if 3 p.m. does not work for you. I'm also particularly looking at you, DOH friends. But of course, it's for everybody. Okay. I didn't hear people unmute themselves and to indicate that time wouldn't work. So with that, we'll plan to meet on the 8th at 3 p.m. And I thank you. Okay. So that does bring us to 2 minutes. I feel like I don't want to go right up to the 3 o'clock because everybody deserves to like have their bio break before they start their 3 p.m. meeting. And because I do think it would be terrible if we didn't thank Katie with the last minute that we have. Katie, you're a remarkable leader. All of us have read about you and have read your quotes, including in the newspaper, and you've been a remarkable committee member. So I want to say, please, all of us, we are so grateful to you and wish you all the best in everything.
Thank you so much. That's really kind. It's been really fun. I'm so glad I got through the report with you all and wish you the best. And I'm sure Mateo will keep me posted on your activities.
Mateo, we're looking at you for that. Yeah. Okay. Thank you, Katie. We wish you the best, and we know we'll keep reading about you in the paper. More. Yeah. Okay. Well, thanks, team. Yeah. Why don't we adjourn with that, and we'll come back to in our next meeting about some other options for some future work. Sound good? Okay.
Thank you.
Thanks, everybody. Take care.
Thank you, everyone.